Hello, everyone. Dr. Nick Kilverma here with another edition of Things I Didn't Learn in Med School. Today, I want to talk about something that I didn't really think much about back when I was in medical school or residency or even fellowship. I hardly even thought about it this past year, but it's something that directly impacts every physician out there, whether you're employed, whether you're in private practice. And I'll go through that why in a little bit. But what it is the Center for Medicare Services, CMS, released their physician fee schedule for the year 2023. Now we know every year or every few years that the CMS always kind of takes lessens the fee schedule for physicians for a wide variety of reasons, mainly because of funding, but also because of politics and other issues that go on behind the scenes that I'm not too sure about. But anyways, it turns out this year is going to be way worse than we thought. I'm looking up on the screen stat. It says the conversion factor is going down by 4.4%, which is a lot. So that makes it going from 3461 to 3308. This directly impacts RVUs and RVU, the relative value units that we all work so hard for to see how we're getting paid. And the reason I say that it affects everyone, whether you're employed or not, work outside the hospital or whatever, is now if you are employed by a hospital, they're going to still expect that same work for you to be done. They're still looking for that same money for you to be producing. So they're going to make you work harder for that same amount of money. And in fact, it's probably worse than that because hospital systems and orthopedic groups and big multi-specialty clinics, unfortunately, it has to be said that a lot of these places are looking for their revenue and revenue only. So that's all they really care about. So with that being said, is even there, they're going to make you actually work harder next year to make up that difference. But they also want to turn a profit. And they want to show increasing profit year after year. So they're going to make you work even harder for the following year. So you have to keep this in mind. And it's super relevant. It's super important. And I don't think that we're doing a good job as a physician community to get together and combat this. I know certain societies are. The American Society of Interventional Pain Physicians, the American Medical Societies are also involved. But I think we all really need to come together and do more. The American Academy of PM&R is doing a great job, but I think it all individually, it's like, hardly even moving the needle. We need to get together as physicians across specialties, across groups, and see what we need to do to reverse this. And the reason why it's such an important thing is, we've had crazy inflation in the past few months, not even the past year, but the past few months. Inflation's been going up about 9%, 15%. So this pay cut, this 4.4% pay cut, is actually effectively 20% pay cut in physician salaries or how physicians are getting paid. So this directly impacts everything, every aspect of healthcare. We have to work harder to make the same amount of money. We have to see more patients. We have to do more procedures just to make up that same amount of revenue. And at what cost? At the cost, most likely, at the cost of giving our patients the adequate time and dedication that we should be giving them in the first place, which is kind of how we got to where we are. So that's the main point I wanted to bring up. And what kind of makes this all even crazier is the insurance companies. The Associated Press put out a article last week saying that health insurance individual marketplaces across 13 states and Washington, D.C. will raise average of 10% next year. So that means that the price for people paying for health insurance is going to also raise by 10%. So that means even our patients are going to be paying more money and the physicians are still getting paid less. So just think about that. I know the individual marketplace, that's the payer market, doesn't have much to do with CMS directly, but the point still remains that, with the higher prices for patients, they're going to start looking for alternative cares. They're going to start looking for cheaper cares. They're going to forego some things that they can't afford. Whether that be foregoing colon cancer screening with colonoscopies, which may be one of the most preventative cancers that we can deal with. Not all types of colon cancers, obviously, but that's a very important point. That's why we screen with colonoscopies. But if a patient can't afford that because now their physician or the health insurance is 10% increase, they can't afford that, and a lot of people can't afford their deductibles now, or their co-pays now, or their co-insurance now, which are all different terms and all things that go into patients' budgeting. And at the same time, if physicians are getting paid less to see Medicare patients, I can see a world where these physicians are going to stop seeing Medicare patients, and they're not going to get the care that they deserve. It's not a very likely scenario, but it is a scenario that you know could be coming up. And there's, I'll put in the plug now. Is it's something we can do about this. If you are part of one of these societies, then ask your society what they're doing and how you can help. You write a letter to your legislation, your congressman or congresswoman in the area. Whatever it takes to try to push this needle to help out. And in medical school and residency, I didn't think it was going to directly affect me. I didn't think too much of it. But now I'm on the other end. Like, this matters. It matters a lot more than you think it does, because if we continue to decrease the physician fee schedule and we continue to increase inflation and cost of living, which naturally has a cost of living naturally has built into societies, that is going to be a huge detriment, and a lot of physicians are just going to be fed up. And are they going to leave medicine altogether? Are they going to stop seeing as many patients? I don't know. I don't know what that looks like, but it's not something that I really want to, entertain at this time. Because I feel like we can do something about it, and we should do something about it. Um, and kind of on the same points, this topic, this other article report that came out, United Healthcare reported a $5 billion profit in the second quarter. Let me say that again. $5 billion profit in the second quarter alone. Just let that soak in for a second. So it's not the physicians that are getting the reaps the benefits. It's not the nurse practitioners or the PAs or the hospital staff. It's insurance companies, the C-suite insurance companies. It is the C-suiters in the hospital systems that are kind of backdooring these policies altogether. And I don't want to make a blanket statement of, all insurance companies are evil and all people that are running this evil, or all the hospital administration is evil. But you start looking at the numbers, you start thinking about these things. It's like, maybe people don't even know what they're doing or what they're getting into. So it's important because for them to be making that much money, I mean, I don't necessarily feel that the care is getting any better in society, and I feel like we're helping more people than we should be. It's great that we're getting great new technologies out there, and we're getting great new results with different medications and stuff, but overall, the hierarchical picture of everything, I don't feel like everything is getting better as a whole for society. Maybe it is. Maybe someone has some numbers out there that could show us and explain that, but I don't really see it. And look over some other points that I've talked to. Um, those are some of the real important things that I wanted to bring up. And I'm not a huge advocate for healthcare policy and legislation, and writing these letters to congressmen and women out there. But this is something that I feel is important, and I feel when these topics do come up, it's something that we should get together and band together and talk about and see what we can do to help not only patients out, but help ourselves out. You know, it's not that physicians go into medicine to become rich, but being paid adequately for your time, especially when the cost of living goes up, especially when inflation goes up. This is very important stuff. Um, there's a few people that I follow that I talk to on a daily basis. Um, mean, I don't talk to them on a daily basis, but I follow them and I, interact with them through social media that, might be worth your time starting to listen to some of these people just so you have a better grasp of what's going on around you and who you can learn from. Um, I follow this finance blogger turned into podcaster. Um, her show is called Money with Katie. I think it's a highly entertaining show. She's highly charming. She really breaks things down into an accessible, bit-sized information that you can actually go do something about. She had a podcast episode a few weeks ago, maybe 6 to 8 weeks ago, and it was all about the healthcare industry and kind of blew her mind when she took that deep dive into it. So I highly recommend you going back and looking at that episode. The Relentless Health Podcast, Relentless Value Health Podcast, or I think that's what it's called. I'll put it in the link in the show notes as I normally do. It's another one, and they just she goes over tons and tons of healthcare policy and how we kind of got to where we are and what things we can do to make things better. Again, very good podcast. She is also very easy to listen to. She asks the great questions. She also makes things accessible and makes you feel like you're right there in the conversation. Another person I follow is AJ Kavanaugh on Twitter. He and I don't get along with a lot of things, politically especially, and sports wise. He's a Michigan fan. I'm a Ohio State fan. But when it comes to healthcare policy, he does do a good job of explaining things. And I believe his wife is a physician, and he's kind of seeing firsthand from his point of view of what she's going through and what she has to deal with. So those are some valuable people to follow or kind of look into. Dr. Eric Bricker has this A to Z YouTube channel, which is also fantastic. It will blow your mind. Every time he breaks something down, he breaks it down in such a way that you can walk away explaining it to someone else. And that's kind of one of the first people that I started following for this kind of stuff. Whenever I want to understand how health insurance works, or how copays work, or how premiums and deductibles, and why it makes sense that physicians invest into a surgery center. I usually, and he's been doing this for many years. He's wore different hats. I think he does a fantastic job getting that kind of information out there. That's all I really have tonight. I think it's a little bit shorter, but I think it's an important concept, and this is something that I want everyone to go do and advocate for on behalf of the physicians. Advocate for yourself. Even if you're not a physician, and you can see the detrimental impact this has on the long-term health community, I think it's worth your time to go write a letter to the legislation. What I'll do is I'll put some sample letters into my into the YouTube channel. So please go, if you do have the time, to click on the links, hit those talking points in the letter, and then you can send it immediately, and we'll see if we can make some change. I think it's important for the longevity of the healthcare community, and important the longevity of our patients, and providing the best care that we can continue to provide. So, anyways, hopefully you guys found this one useful, and hopefully you guys will all join me in making this campaign important and on the forefront for the next few months. This was a hot topic last week, but I think it dwindled down because other hot topics obviously came up, and that's how the nature of our world is right now. So I think bringing up these topics time and time again will be important. So, anyways, please share, please like, please subscribe, and I'll talk to you soon. Thanks.